Thank you, Mr. Chairman, and I appreciate your work and the work of the ranking member, Dr. Rowe, and others on the committee who are working to support our veterans. And Dr. Stone, it's good to see you again, although virtually. And I'm glad to hear about your family. Our thoughts and our prayers go out to you, and thank you so much for your service to our nation's veterans. I look forward to seeing you again in person someday soon. I want to just address a couple questions regarding the PPE supply chain. Dr. Stone, you had testified in front of the Senate Veterans Affairs Committee on Tuesday, and you noted that COVID-19 shattered the global PPE and other critical item medical supply chain. You've acknowledged the importance of domestic manufacturing and the need to boost production of American-made PPE. What specifically is VHA doing to ensure that you are buying PPE from American companies whenever possible?
I'm going to defer to Ms. Kramer on this.
Thank you. Yes, our first priority is always to buy American, but as you know, sir, most PPE is not made in the United States, it's made overseas. And that has created some great challenges for us. We are not working directly with overseas manufacturers. We're working through a number of different suppliers, a great number of SDVOSBs and veteran-owned businesses who then work through brokers or directly with manufacturers overseas to obtain that material. But we do indeed need to bring the manufacturing back to the United States. This is a readiness issue. This healthcare and public health are readiness issues. And to be able to ensure that we're prepared for the next round or for the next pandemic, we need to bring that manufacturing back to the United States.
Absolutely. I think we all agree with that. We have to bring this manufacturing back and these jobs back to our country so we're not so reliant on adversaries during a time of national crisis. There are still some companies in the country that produce PPE. I can think of one in particular in my district I had toured last year who said that, like you had mentioned, 99% of this stuff is made overseas. We only have a few companies here that do make it, but for the ones that do make it within this country, does VHA have any kind of preferential treatment to American manufacturers of PPE when negotiating contracts? Do you guys give any kind of preferential treatment to U.S. companies?
The law actually requires us to give them preferential treatment, and we do.
Okay. All right. I want to move on to testing. I know there's been a number of questions regarding testing. Dr. Rowe asked about it, Mr. Levin, and I want to just ask a couple questions. I've heard from several constituents who have gone to their local VA facility to get tested, but have been sent away. Some have been told to go to another location, like a local Rite Aid, while others have been left. Others have left the VHA facility confused as to what to do next. I've even heard veterans who are getting turned away who are symptomatic and unable to get tested. Can you tell me just what kind of guidance you're giving to local VA facilities and in terms of testing?
Yeah, well, let me first ask, please, if you hear of cases where veterans are being turned away from testing, tell us. Because we need to investigate those and understand why that's happening. So, it bothers me to hear that. We should be providing to a symptomatic veteran a test, unless there's some circumstance where it's just absolutely not available for some reason. But we do want to hear about those cases. In terms of employees, I think I refer back to what I said earlier. We've been challenged, just like everyone in the country, with enough supplies to actually collect samples to perform the tests. We want to be able to test everyone, and that's our goal, and that's the way our policy has been written.
So can we make a commitment here today that any enrolled veteran who shows up at a VHA facility and asks for a test can get a test?
I would say I'd like to make that commitment, but we do not have enough supplies. But as soon as we do, we will broadcast that so veterans know that that is the case.
Congressman, let me commit to you that that is exactly where we want to get to. But what I don't want to happen is a sick veteran not have access to a test. And we have tremendous machine capacity. What we don't have is enough transport media, cartridges, swabs, in order to assure that on-demand testing across the system. I think that's exactly where we'd like to get to. But remember, when people talk about drive-through testing or on-demand testing, often you don't get your test back for a week. What we need to make sure of is if a sick patient comes in, that we can make a decision quickly and have enough rapid testing available to assure the safety of our personnel and that patient.
Thank you. I see my time is up. I had some questions about in-person care, but I'd like to follow up with you guys separate from this, and I yield back. Thank you all.